Good morning everyone. Welcome on my YouTube channel. Myself Dr. Ravi Keshri. Today I am discussing about the upper motor neuron and the lower motor neuron. What is the difference between the upper motor neuron and the lower motor neuron? I will discuss today. The upper motor neuron. What is upper motor neuron? The upper motor neuron, that is the lesion, may be due to the damage of the pyramidal cells in the cortex or damage of pyramidal tract anywhere between the cerebral cortex and the spinal cord. That is the upper motor neuron. The lesion may be due to the damage of the pyramidal cells in the cortex or damage of the pyramidal tract anywhere between the cerebral cortex and the spinal cord, that is the upper motor neuron lesion. And the lower motor neuron, what is lower motor neuron? The lesion may be due to the damage of the motor cells in the anterior horn cells of the spinal cord or motor cells in cranial nerve nuclei or their axons, that is the upper motor neuron. Lesion may be due to the damage of the pyramidal cells in the cortex or damage of the pyramidal tract anywhere between the cerebral cortex and the spinal cord. Between the cerebral cortex and the spinal cord, here is the TS of the spinal cord, here is the cerebral cortex, and here the midbrain, the bones and the medulla. The lesion between the cerebral cortex, anywhere between the cerebral cortex and the spinal cord, is the upper motor neuron lesion, and it is due to the damage of the pyramidal cells in the cortex or damage of the pyramidal tract anywhere between the cerebral cortex and the spinal cord, that is the upper motor neuron lesion. Now the lower motor neuron. What is lower motor neuron? The lesion may be due to the damage of the motor cells in the anterior horn cells of the spinal cord. Anterior horn cells in the spinal cord, there are the anterior horn cells, the lateral horn and the dorsal horn. The ventral horn, the dorsal horn and the lateral horn. The lesion in the lower motor neuron lesion, the lesion is due to the damage of the motor cells in the anterior horn cells of the spinal cord. Here is the anterior horn cells of the spinal cord or motor cells in the cranial nerve nuclei, or their axons, that is the lower motor neurons. And these are the difference between the upper motor neuron and the lower motor neuron. The lesion between the cerebral cortex and the spinal cord is the upper motor neuron, and lesion in the anterior horn cells of the spinal cord or the motor cells in the cranial nerve nuclei, here I am showing the cranial nerve nuclei or their axons, that is the lower motor neuron. And the most common example of the upper motor neuron is the hemiplegia. Most common example of the upper motor neuron is the hemiplegia. What is hemiplegia? There will be the paralysis. There will be the paralysis of the one side of the upper limb and the lower limb. That is the hemiplegia. Some terms are the quadriplegia. All the upper limb and the lower limbs are paralyzed. That is the quadriplegia. And next term is the quadriparesis. Weakness in the all the upper and the lower limb. That is called the quadriparesis. Weakness in the upper limb and the lower limb, that is called the quadriparesis. The most common cause example of the upper motor neuron is the hemiplegia, and the most common examples of the lower motor neuron, it is due to the injury to the anterior spinal root and Bell's palsy or the poliomyelitis. The Bell's palsy, the poliomyelitis, and the injury to the anterior spinal root and Bell's palsy and the poliomyelitis, these are also the most common cause of the examples of the lower motor neuron lesions. It affects a group of muscles. The upper motor neurons affects a group of muscles, whereas the lower motor neurons, it affects a single muscles. It affects a single muscles. There will be the spastic paralysis. There will be the spastic paralysis, that is the hypertonicity. The tone of the muscle will be increased. That is the spastic paralysis. The tone of that is hypertonicity. The tone of the muscle is increased. Where in the lower motor neuron, there will be the flaccid paralysis. That is the tone of the muscle is decreased. That is the tone. That is the flaccid paralysis. The atrophy of the muscle is mild in case of the upper motor neuron, whereas in the lower motor neuron, the muscles gets completely paralyzed. The muscle gets completely paralyzed. And the tendon reflex in case of the upper motor neuron, there is the X aggregated tendon reflex. It means the tendon reflex has been increased. where all the superficial and deep reflex are lost in the lower motor neuron lesions. There will be the Babinski signs positive in the upper motor neuron, whereas in the lower motor neuron the Babinski signs cannot be elicited. It means what is Babinski signs? There will be the dorsiflexion of the upper toe, and the abduction or fanning of the other toe. That is called Babinski sign. It is normally present in the infants, that is from the birth to the 12 month of age. It is generally present, but after the 12 months, if the Babinski sign is positive, there will be the dorsiflexion of the great toe and the fanning of the other toe. It means there will be the lesion of the upper motor neuron lesions. The lesion is the upper motor neuron lesions or damage of the pyramidal tract has been diagnosed. These are the differences between the upper and lower motor neurons. The most common disease in case of the lower motor neurons, that is the poliomyelitis. In poliomyelitis, the lower motor neuron this is the lesion of the lower motor neurons, and there will be the flaccid paralysis. The tone of the muscle has been decreased, and there will also occur the Bell's palsy. This is all about the upper motor neuron and the lower motor neurons. I have discussed the difference between the upper motor neuron and the lower motor neuron. Thank you.